an hour ahead. Good afternoon, everyone. I'm Becky Widish, Chairman of the Niagara County Legislature. Thank you for joining us today for our Niagara County COVID-19 update to our community. We're currently live on LCTV, we're streaming live on lctv.net, and we're on 90.9 FM on your radio. I have with me again today our Director of Public Health for Niagara County, Daniel Stapleton. Dan, let's just start right out. Unfortunately, it's my understanding that we have had another COVID-related death here in Niagara County since our last update.
Yes, unfortunately, we do have one more, an 88-year-old male who had underlying health conditions, passed away over the weekend, and our heart goes out to those people, the family and friends of that individual. It's a number that we wish we didn't have, but these numbers are increasing on a regular basis. So right now we have 5 new positive cases. That brings our total to 279 to date. 130 people are in isolation, and of that 130, 18 are in hospital isolation. The remainder are isolated at home. And this is an important number. The 133 people have recovered so far. That's an important number because it shows people they can be positive for COVID, they can have the symptoms or be asymptomatic, but that they eventually recover from the disease. And that's an important thing that people understand. And those numbers are increasing every single day. So we're we think that's important. People realize there is light at the end of that tunnel.
Of course. We have our heat map up on the screen here. Remind everyone again, of course, that our heat map is available on the niagaracounty.com website. At the top of the page, there's a COVID-19 banner where you can find that heat map. Dan, anything to say about the heat map and where those cases are showing up and how that looks at this point?
Well, the numbers aren't surprising. They continue to be in the high density population areas, Niagara Falls, North Tonawanda, Wheatfield, but we will be updating the map tomorrow with it'll provide more information than it currently does in terms of the number of people in isolation, unfortunately the number of deaths, but gives people a little bit more information than they might just get from the map. So we think people will find that helpful.
Of course. And the other map that we've told our viewers about, of course, is the state COVID-19 tracker map. There's also a link for that on the top of the Niagara County page where you can look, and that will break down things by county, again, give you much more information. And one of the pieces that it does show is how many tests are done in each county. Dan, how is testing going here in Niagara, and what can you tell us about the new antibody testing that we're hearing about too?
Well, the numbers are going up in terms of testing. We are approximately 1,300 so far. We just received 100 test kits just over the weekend, so that helps. It allows us to be able to make sure we're getting all the first responders, healthcare workers. We're expanding that out to people who work in nursing homes. We know nursing homes are a sign of concern for us because the numbers of residents getting sick is going up, and number of positives in the nursing homes are going up. So it'll allow us to take that 100 and put it towards trying to provide testing for people who work in assisted living centers, nursing homes. These are people who have symptoms, and it allows us to make sure we're preventing the spread of the infection through a nursing home or through an assisted living center. The antibody testing, that's brand new. It just started over the weekend. It's a test that we're hoping shows a lot of promise. It allows us to identify what the percentage of people in a community are in terms of the percentage of positive cases. That allow decision makers like yourself to decide whether or not the penetration, the numbers are actually going down in terms of the number of cases. That's always a good sign, but we want to make sure we have good data, and the antibody testing is just another tool we hope shows promise.
Right. Okay, and you mentioned nursing homes. We did talk about the nursing homes and assisted living facilities a bit last week when you were on with me, and that's something that has only become more serious since we had that discussion last week. We hear the governor talk quite a bit about this now and some of the discrepancies in the reporting that's coming out, and we know again that your department isn't necessarily tracking those are handled by the state health department, and you don't receive all of that information back to be able to verify it. So we know when we're talking about deaths in Niagara County that they're not necessarily included in those numbers. We're hearing from the state information that there may have been 8 deaths in Niagara County health facilities. What are your thoughts on that and how that process is working or what's going on in those facilities?
Well, we know right now that although we don't have oversight of nursing homes, we still identify a need to help the residents of the nursing home and the people who work in the nursing home. So to make sure that they're protected and to make sure the residents are protected, that's why we'll be offering the testing kits to the nursing homes to get a better idea. We do know that the residents have not been leaving the facilities. There's been no visitors allowed for 5-6 weeks. So we know it's coming from workers. We want to be able to ensure that workers who have symptoms are being tested. So if they turn out to be positive, we can stop that transmission right at its source. So it's an important tool. We identify that we need to make sure we can help all residents of Niagara County, and that includes the residents of the nursing home. They're vulnerable. We're going to do whatever we need to do to make sure that they remain safe. And if that means that we help by providing kits, or we offer insight, or we offer PPE to nursing home, we'll do that.
Very good. And the governor mentioned this morning that this has now been 51 days since the first positive case of COVID-19 was announced in New York State. The good news is hospitalizations, intubations are down statewide again. The death toll is still staggering. It was announced 478 cases today of deaths related to COVID-19. Now that number is way down from what we were hearing in the previous days of 600, 700. So that number is declining, which is good, but still a pretty large number to hear. So the governor is saying that maybe the high point for Western New York is still coming. What can you tell us about what's happening down there versus here, and your thoughts kind of on that peak?
Yeah, I mean, I tell people I believe we're in the surge because our deaths are happening every other day. Sometimes we had last week 3 deaths in 24 hours. So we know that I believe we're in the surge. It all depends on how long does the surge last. How long does it take before we get to the point where we reach our peak? Hopefully we reach our peak and we decline rapidly, but there's also the ability, like it was in downstate, that it reached our peak and the peak plateaued and stayed there. And you've been seeing the horrible number of deaths continuing downstate. So I believe from what we have, we wish we had more testing, but based on the testing we have, I believe we're in a surge right now. Hopefully we'll know more by next week and the week after that, because you don't know that you've had a drop or that you've reached the peak until you have a couple of weeks of drops. So that's why it's difficult to know where you are. But we had 5 cases just since yesterday. We've had weekends where we've had 24 on one day. So we're happy that the numbers aren't increasing as rapid as they were, but it's hard to know where you are. I think we need more testing to know that, and hopefully we'll know more within the next week or 2.
Okay, and I think the overall feeling, that I hear is we are behind that time frame from the downstate area. We're seeing them starting to flatten that curve, and the hope and the optimism here is that what we're doing is working.
Absolutely.
The distancing, the sacrifices we're making, the fact that we have been staying away from each other is working, and we continue to share that message that we don't want to see this go in the other direction very quickly. So we just need to keep those guidelines in place for now, follow them to the best of our ability for essential purposes only, and be sure that we keep on the trend that we're on and don't see a drastic rise suddenly.
Yeah. I think the key is that nobody should expect that we're going to go right back to normal. And I hate when people use the new normal, but that's really what we're looking at. So just if we start seeing what we believe to be a decrease in cases, and we've seen that as a trend, then we take the data and we make decisions on changes based on the data. All the decisions I make, I look at the data, and the data will either tell me, look at it a different way, or make changes. And you never want to be afraid to make changes in your policies and your decisions if the data shows that you need to. So we're using the data. We're hoping that data leads us in the right direction, and that we make smart decisions based on that. But we don't want people to think the numbers are going down, I can change what I've been doing. People need to stay put. The worst thing that could happen to us would if we let up on those things too quickly and we ended up having a resurgence of disease. But we can make smart decisions based on sound data, and we're going to do that.
Right. And along those lines, Niagara County did announce today that our golf courses, campgrounds, boat launches, and marinas within the county are open at this point. We put the statement out to kind of clear up some confusion, and this was done in accordance with, of course, the governor's executive orders and guidance from your health department as well. And we just want to, make sure that our residents understand that all social distancing rules are in effect in these situations. We're taking many special precautions to be sure that these activities are offered up safely for our residents, of course. For example, at the golf course, tee times will only be available by appointment by calling 716-439-7954 to set up your tee time. We're offering fewer tee times per hour to keep some distance between the groups. Golf carts are not available at this time. You must walk the course. The pro shop remains closed. The greens cups have been partially blocked to reduce the need to retrieve the ball from the hole. Flags should not be touched. Ball washers and other common surfaces have been covered and are not available for use. Dan, I just want to get your thought on these recreational activities, about having these available, and your thoughts on the safety and ability to use those at this time.
I think the number one criteria we all follow is making sure we respect the social distancing requirements, making sure we don't, that the density of people, of the population is spread out. Those are just smart things to do. And I think based on people being able to follow those rules and those recommendations, I think people should be at no risk. But people need to make sure that they're following recommendations, because these are made with a lot of discussion, a lot of consideration, and as long as people follow those guidelines that you stated, people should be safe.
Again, this is the reminder that these activities can be done safely, like going out and taking a walk with your family, that this is not the time to get together with your friends that you're not seeing right now for a camping trip or a round of golf. This is immediate family who would be doing things together already at home. It's safe to sit around a campfire with, just the parents and the children, or to go out for that round of golf with, a parent and a child. This doesn't mean that, we want individuals to start socializing with other individuals yet that they aren't normally living with. So again, these, will as long as people are following those distancing guidelines, these activities will be available, but we will of course monitor that situation if we need to, and just, make sure that everyone's following those guidelines to keep everyone safe at this time. Let's see. Updates on other county services. We do want to remind you that our treasurer's office has resumed normal business hours from 8:30 to 4:30. Again, of course, that is with all of those safety protocols put into place to protect the public and our staff. If you need to make a tax payment or handle other things that you need to take care of with the treasurer's office that cannot wait at this time or can't be handled over the phone, again, that office is available to you if you need it with those safety measures in place. Dan, I just want to thank you again for being here with us. Keeping our residents updated, of course, and informed is the most important piece of this for all of us, so that everyone knows the situation and knows what's going on. Again, a great big thank you to your entire team who's been keeping our community safe, and you're taking care of everyone at this time.
Yeah, thank you for saying that. The staff is what holds all this together. They're on 24 hours a day. They're there on the weekends. Our nurses are actually speaking with patients, making sure that people have the supplies they need when they're quarantined or isolated. So yeah, the staff is what puts all of this together. So thank you for having me.
Of course. Want to remind all of our residents again of the Niagara County Mental Health Crisis Services line. That number is 285-3515. This is 24/7 free and confidential help for anyone right now who's struggling. We know this can be a difficult time with all of the uncertainty and the worry and concern and the financial concerns. We heard from our district attorney that domestic violence cases are up at this point. We've also heard that overdoses related to substance use disorder at this time are increasing as well. Please, if you have any of those concerns, reach out to that crisis services line. Also, if you would normally be utilizing services from an organization and going to group counseling and things like that, again for substance use disorder, alcoholism, reach out to those organizations. Most of them are offering some form of help at this time. Even if it's by video or teleconference, they are still there to support you. So please, if you're struggling, reach out Friends and family members, if you have a loved one that deals with substance use disorder, again, this has been a time where we've seen an increase, unfortunately, in those overdoses. And we just want to remind you again that if you have that individual in your household, if you're worried and concerned, please make sure that you have Narcan available and ready to use in that situation. And this goes for the person struggling or the friends and family members. Again, you can call Crisis Services at 285-3515. If you joined us late today, you can catch us on demand on lctv.net under the Niagara County Legislature page. There'll be a link later today. They'll also replay us as their schedule allows throughout the evening. We want to thank, of course, all of the other stations who utilize our live broadcast to get information out to the public on their channels, and the newspapers who pick up pieces to write those stories and get the information out any way they can. Thank you to LCTV for this wonderful partnership. We appreciate it. For the residents at home, again, I remind you, please just stay home, stay safe, and stay healthy.